Palmar grasp in neonate. It can be elicited by placing an object or examiner forefinger placed in newborn's palm. As a response, the neonate grasping of object by closing fingers around it. It is an involuntary movement when we are placing our hand in the palm of neonate, involuntarily close the palm. The reflex may be so strong that a neonate grasping the examiner forefinger can be lifted from the supine to standing position. And age of disappearance of this reflex 6 weeks to 3 months of age. After 3 months of age, it will be a purposeful grasp. Up to 3 months of age, it will be involuntary movement. After that, it will be a purposeful grasp. Thank you. Rooting reflex in neonate can elicited by touching or stroking the cheek near the corner of the mouth. As a response, head turns in direction of stimulation so that the neonate can find food. In this way, the breast touches the cheek, the neonate turns towards the nipple and starts sucking. Babinski reflex elicited by stroking the lateral aspect of the sole of the foot with a relatively sharp object from the heel up toward the little toe and across the foot to the big toe. Fanning of the toes will be occurs as a result. The adult normally flexes the toes, that is known as negative Babinski. The newborn responds mainly due to immature level of nervous system development. 3 months of age, it will be disappear and it may variable. Moro reflex or startle reflex. Startling the infant with a loud voice or apparent loss of support due to a change in equilibrium. As a response, generalized muscular activity, symmetric abduction and extension of arms and legs with fanning of fingers, the thumb and index finger on each hand from a C shape. The extremities then flex and adduct. The baby may cry due to change in equilibrium. Age of disappearance by 3 to 4 months. Sucking and swallowing reflex. Touching the lips with the nipple of the breast or bottle or other object. Sucking movements that enable the newborn to take food. And this begins to diminish at 6 months of age when the baby starts weaning or taking extra food. Okay. The swallowing reflex always accompanies with the sucking reflex. Food reaching the posterior of the mouth, that is swallowed. And the swallowing reflex, it will not be disappear, but sucking reflex will be starts to diminish after 6 months. Up to 6 months, there will be continuous breast milk feed. After that, there will be weaning starts. That's why there will be a diminution of sucking reflex. Extrusion reflex. Newborn extrudes any substance that is placed on the anterior portion of the tongue. This protective reflex prevents the swallowing reflex of inedible substances. It disappears at about 4 months of age. In extrusion reflex, you can see that the child is protrude his tongue in order to prevent the substance. So that is extrusion reflex. When we are placing anything that is on the anterior portion of the tongue, there will be protective reflex that prevents the swallowing reflex. Foreign substance, coughing and sneezing reflex. Foreign substance entering the upper or lower airways clearing the upper air passages by sneezing, the lower air passages by coughing. It will not be disappear. So sneezing and coughing reflex always with us, and the when the foreign substance entering in our body as a preventive measure, we are having the reflex of sneezing and coughing. This is the gagging reflex. Gagging reflex when more is taken into mouth that can be successfully swallowed. Immediately return to undigested food. When gagging reflex is when more than when we are taking lot of amount of food, it will be vomited. Okay, so that is the response in gagging. Okay, so usually when the child is take multiple type of food, if it is not digested, usually the child is vomited. So that reflex is known as the gagging, immediate return of undigested food. We are having a nauseated feelings, no? So before vomiting, so that is the gagging reflex. Doll's eye reflex. Doll's eye reflex turn the newborn head slowly to the right or left side. As a response, normally eyes do not move. So that is the doll's eye response. When the infant head slowly turned, the infant's eye will remain stationary. That is the doll's eye movement. Dancing or stepping reflex. In order to get this response, hold the neonate in a vertical position with the feet touching a flat or firm surface. As a response, the baby will rapidly alternating flexion and extension of the legs as in stepping. And the neonate soon after can bear some weight on the legs without stepping. Tonic neck reflex. This response can be elicited by turning the head quickly to one side while the infant is in supine position. So in this picture, the child head is turned to one side when the infant is in supine. As a response, you can see that arms and legs on the side, the head is turned toward extend. Arm and leg on the opposite side flex. Both hands may make fist. And this reflex will be disappear 80 to 20 weeks. Tonic neck reflex is replaced by symmetric positioning of both sides of the body. So tonic neck reflex is nothing but when we turn the head quickly, there will be extension of the same side of the head is turned, and opposite side there will be flexion.